Welcome, everybody, to today's webinar on Embracing Change Together, Partnering for Successful Child and Family Outcomes. Angela, if you can go back one slide, I'll just go through a little bit of housekeeping for folks who are new to the webinar system. Currently, everybody will be muted. We have quite a few folks that are registered for the webinar. So you'll be able to use that chat box that's on the right-hand side of your screen to communicate with us. If you don't happen to see that chat box, there's a little bubble at the top that says chat that you can click, and that'll open up the chat box in your panel. Make sure that when you want to send us some comments or some feedback or some questions, then when you type it into a little box, there's a little send to drop down. Make sure you hit send to all panelists before you actually submit it. That way all the presenters can see your question. We'll have some time at the end of the webinar to answer any questions. And if you happen to have any technical issues, please feel free to chat that in to our host, Brianna, who you'll also be able to see in your drop-down, or this is her email, brianna.concalves@nyu.edu. And as a reminder, all our webinars, recording, slides, handouts, anything that we have available is on our website, ctacny.com, including this webinar will also be made available in case you have any colleagues who weren't able to join. So without further ado, I'll hand it off to Dr. Andrew Kleek.
Hi, everybody, and welcome to the webinar today. I'm Dr. Andy Kleek, and I'm the co-director of the Community Technical Assistance Center as well as the Managed Care Technical Assistance Center, so I've probably run into many of you in both of those different roles. We're really excited today to have our kind of pre-summit webinar, Embracing Change Together, really to give an overview of the children's transition and where the children's system is going. Some of the stuff may be familiar to folks who have been part of this process for quite some time, but some of it will be new, and we're also going to talk through the summit, the agenda for the summit, kind of what the day is going to be like, and give some very, very brief description about the Managed Care Readiness Assessment, which we're asking folks to complete prior to attending the summit. And also, just to give a little plug, I'll give another one later, but just a little plug, we'll have a targeted webinar tomorrow just on completing the Readiness Assessment for people who have extra questions. So without further ado, I would like to pass this on to Angela Keller, who's going to walk us through the children's plan. And just a reminder to folks that Angela is going to go through the content, and she might take a break in the middle if she's moving quickly, but we may wait until the very end to take questions just to make sure we get through all the content today. But you can chat in questions as they come up. You can chat in questions as they come up, just because if you're anything like me, if you don't write it down right away, you forget what you're going to ask. So feel free to chat them in as they come up, and we'll keep track of those and then read them out when we pause for questions. So Angela is the Director of the Bureau of Children's Program Design, Planning, and Policy and Planning and in the Division of Managed Care at the Office of Mental Health. And with that, I'll pass it on to Angela.
Thanks, Andy. Well, we're going to start off with just a quick poll question to get a sense of who our audience is today. So you should see up on your screen the question. Just curious whether this is going to be the first time that you have heard about the Children's Managed Care transition. So A is yes, this is your first introduction. You haven't had a chance to listen to many of the previous webinars. B, you've heard it a few times, but maybe it's been a while, and this will be a little bit of a refresher for you. C, you've listened many times to the webinars. And D, you are so familiar that I could turn the presentation over to you. So if everybody would vote, and we'll see what our results are. So part of what we're going to talk about today, and hopefully for some of you this is good review, but again we're waiting for you to answer the question, is it's a complicated...
All right, Angela, so we've got our results. So it looks like the most people have listened often. So we've got the most people have heard this before. There are about a third of the people who responded who said that this is the first time they're hearing of this, and another third who are in that middle group. But about you know, a good chunk of people have heard this quite a bit before.
Great. Thank you, everybody. And I'm hoping that the 5 that are very familiar and could present this topic are actually one of the 4 people or any of the 4 people that are listed on this slide. So this is our Children's State Leadership Team across the 4 state agencies, so the Office of Mental Health, Department of Health, Office of Alcoholism and Substance Abuse Services, and the Office of Children and Family Services. This design and the process that we've been undertaking is very much an interagency collaborative effort. And underneath each of these leaders, we have a number of staff from each of the 4 agencies that participates in many work groups and thinking through this design. So our plan as we move towards our transition date is to really transform the children's service delivery system. As many of you who have heard some of this before, you know that this will be a huge undertaking. For some, this will be great change in terms of organizations, how we do business, but hopefully children and families will be served better. We are committed to the key points that are on this slide, and they've really been guiding our design and decision. We want to expand services that are available to all children, expand the number of children that are served, and be able to offer all Medicaid services within the managed care delivery system, and integrate this service delivery within the health home to serve children model. In addition to the key points, our ultimate goals are really to make sure that we identify children's needs earlier, we maintain children at home with their families with the necessary supports and services that they need, that we infuse a trauma-informed approach in service delivery, and that children are maintained in the community in least restrictive settings, and we really are preventing longer-term need for the higher-end services, which have really been the focus of many of the children's service systems. When we reach our goals, ultimately we'll improve quality in these ways, identifying and intervening earlier, having accountability for outcomes and increasing quality of services, integrated approaches to planning and service provision across health and behavioral health needs that children and families may have, increasing the intervention by enhancing the service array, and that all children would have access to the needed services. The children's system changes impact a broad array of children with various needs. These are the children that have traditionally been served by OMH, OCFS, OASS, and through the DOH Care at Home 1 and 2 program. And certainly, as I'll highlight later, as we look to expand the numbers of children that can receive the services through managed care, it will include other children that may not have touched any of our systems. But ultimately, we want children and families to receive the right services at the right time and the right amount. A few weeks ago, a new schedule was released. I think we felt a sigh of relief go across the state as this was announced, particularly on the kids' side. So some of the things stay the same, some of the dates get changed slightly, so let me just go through that a little bit. Health homes designated to serve children, that date did not change, and we will begin that enrollment on October 1st, 2015. For those of you that are OMH TCM providers, you and your clients will transition to health homes on October 1st as well. We hope that the new proposed Medicaid state plan services can be implemented as soon as possible, assuming that we get approval from CMS, and so that the service system can begin to build capacity on these additional interventions to have impact earlier before we get to managed care. Assuming that that is approved sooner rather than later by CMS, these will be available on a fee-for-service basis initially before the transition to managed care. So the managed care transition has been moved to 2017. We will have a geographic phase-in. So January 1st, 2017 is New York City and Long Island. So the services that have been carved out will go to managed care, new services, and we'll get to those shortly. On July 1st of 2017, the rest of the state will transition to managed care, and more than likely later in 2018, we will have population phase in, but we will talk about that at a future date. And just to be clear, because there's a lot of confusion, which moving part transitions when, that the care coordination services that exist within the 6 1915C children's waivers, so that OMH's serious emotional disturbance waiver, DOH's Care at Home 1 and 2, OCFS Bridges to Health, those care coordination services that are integral to those waivers will transition to Health Home Start Serving Children in 2017. So that transition will coincide with the managed care transition. In 2017, Medicaid behavioral health services that are carved out of managed care right now will transition into managed care, and children in foster care will be moved also to managed care and the services that they receive. The existing home and community-based services that are within the 6 1915C waivers will be aligned to one array of home and community-based services benefits pending CMS approval, and will also be moved to managed care. And we'll talk a little bit about how that'll work and how children can access those going forward. At some point after the transition to managed care is complete, the 1915C waivers in their current configuration as separate programs will be discontinued. So let's talk a little bit about the services that will be new in addition to what is already in managed care, the carved out fee-for-service Medicaid services that will come in, and then we're proposing these new Medicaid state plan services. So there's 6 of them. Some of the names will be familiar to people who've had interaction with the waiver programs, and really the impetus behind the development of these 6 services is that we know that many opportunities are missed early in a child's trajectory of challenges that could prevent a costly path for the child and their family's future. In many cases, they have to fail through a variety of programs, interventions, and each time those often rise in intensity and often have to fail many times before they can access the waiver services or the home and community-based services. By that time, the child and the family have likely developed a more complex array of challenges that, had they been addressed earlier, may not have occurred or may not have gotten to the point that they are. So as the Children's Design Team thought about several aspects of our current systems and the population served, we really looked at what are the overlaps and needs across systems for all children and families, and what are the gaps in services. We know that with the shortcomings of the current systems combined with our desire to intervene earlier, that this really led to this new set of services. It will enable us to focus on prevention and wellness and a better integration of behavioral health focused services into children's early care. And we believe that this new array works to allow the majority of service delivery to happen in the community where children and families work, live, and go to school. A complement to the state plan services, the new state plan services, are home and community-based services benefits. Unlike the state plan services that will be universally available to all children with Medicaid, assuming that they meet medical necessity criteria, this proposed list of home and community-based services will be available to children eligible for Medicaid who meet specific target population and functional limitation criteria. We arrived at this list of services by aligning all the services across the 6 1915C waivers. These are services which over the last couple of decades we know have produced good outcomes, kept children out of long-term placement, and provided supports to families in order to recover and become more resilient in caring for their children. The services right now are only offered in 1915C waivers, and there's limits in terms of slots across the state, and so we really cannot serve the numbers of children that we wish to be serving. So again, in keeping with our desire for a broader service array that's available to children and families, this list is more comprehensive home and community-based services. And let me just cite an example. So if I were a child in Care at Home 1 and 2, what I would have available to me is care coordination, respite, adaptive and assistive equipment, and palliative care, so those 4 services. As we move this array into managed care, if I were a medically fragile child currently in the waiver or waiting to be in the waiver right now, and I need any of these services on this list, they would be accessible to me. I would not have to leave the Care at Home waiver and go to, say, an OMH SED waiver if I met the criteria to receive skill building or pre-vocational services, for example. So one of the things that has been decided fairly recently is really what will be the fiscal model for these services. So the existing carved out state Medicaid plan services will be in the plan capitation rates and be at risk at the time of the transition in 2017. The new home and community-based services benefits will be outside of the capitation and will be non-risk to the plans for 2 years, and government rates will be mandated starting in 2017. We will go through a process similar to what has happened on the adult side with HCBS service providers being designated, where the state will tell the plans, here are the providers that we are indicating to the plans that they should be contracting with. For the new state plan Medicaid services, these, the dollars associated with paying for those services will be in a capitation rate and at risk, reflecting the cost and utilization as soon as possible pending CMS approval. So how do you get all these services? As I said, the proposed array of HCBS benefits will be the same for all children who meet targeting and functional assessment criteria. So there will be 2 levels, a level of care and a level of need. Eligibility or meeting of this criteria will be determined by the completion of the CANS New York. This has been used in the OMH system and with the Bridges to Health waiver for quite some time, and it's been undergoing a pretty significant revision. The revision will hopefully make the tool more sensitive to all the targeted populations and be able to delineate more levels of acuity for HCBS benefit determination. For current 1915C waivers, you're all familiar with level of care, so that will be maintained in terms of it's for kids that are at risk of medical institutional placement currently or in the future. So the level of care criteria does not change from what we know it to be today with the 1915C waivers. What we create with the level of need is our ability to serve children who have less intense needs, who are not at immediate risk of institutional placement, or those that could be stepping down from higher end services. So for instance, a child that might be leaving residential treatment to return to the community still could benefit from home and community-based services, but no longer meets the institutional risk of institutional placement criteria. Today, as I've said, the HCBS benefits don't exist until a child has reached the level of need of a 1915C waiver. And keep in mind, whether a child in the future meets level of care or level of need, they have available to them the same array of 13 HCBS services. We continue to receive many, many questions about what will happen to children without Medicaid as we move forward with this design. And I want to just be clear about what happens with the current waivers and their transition to managed care once that's complete, and for new children that get identified later on. So currently, children with third-party health insurance and who have dual coverage in Medicaid and Medicare, they're excluded from being enrolled in managed care in New York State. What our design includes is a proposal to evaluate level of need or level of care eligibility, which establishes a child's disability, if you will, and the need for HCBS services. And then that's followed with a determination of Medicaid eligibility without regard to the parental income. Once eligible for Medicaid through level of need and level of care eligibility and the Medicaid budget methodology, this opens the door to access to all Medicaid services for which the child is eligible. So that includes physical health, health home, state plan services, HCBS, for example. So if you're a child that's considered a family of one for Medicaid eligibility, your benefits for home and community-based services will exist in a fee-for-service Medicaid system because they can't enroll in plans. And just as a side note, those children in foster care will continue to be categorically eligible for Medicaid. So this is what I've just reviewed is less of an issue for the foster care population while they are in care. So as I've said, the CANS New York, the Child and Adolescent Needs and Strengths Assessment for New York, is going to play a very important role in determining eligibility for the home and community-based services. The author of the CANS is Dr. John Lyons. We've been working very closely with him, with the New York team, in making revisions. And for those that might not be familiar with the CANS, it's really a tool that supports decision-making, identifying needs from materials, interviews with providers, serving a family, interviews with a family, and really looks at once needs are identified, how does that need to be integrated into service planning. It also facilitates quality improvement initiatives where we can look at children over time and how their needs change or their family's needs change, how strengths are built over time, and really allows for the monitoring of outcomes for individual children and for a group of children. So the CANS New York will have many uses in New York. Some of that's already in place, and some is yet to come. So the CANS New York will have an algorithm for health home acuity level and help determine whether a child meets low, medium, or health home acuity, and then their corresponding rate payment assignment. The CANS will also provide information that may help determine if the children meet the health home eligibility criteria, particularly for children with serious emotional disturbance and who have experienced trauma. So the CANS New York and the health home algorithm will begin to be used in October as children are enrolled into health homes. And then in the future, in 2017, the CANS will be used to determine the need for home and community-based services within the managed care service delivery system. And one of the last things I just want to point out, there have been previous webinars on health homes to serve children. On the DOH website on April 29th, we've posted a lengthy webinar giving a lot of updates about health homes to serve children. So if you haven't had a chance to view that, I encourage you to do that. Health home and its care managers will really be an important intersection with the managed care design and that transition. Many of the children that will be eligible for state plan services and HCBS benefits will also be eligible for health home, and the health home care managers will coordinate all services that a child and family may need to reach their goals and achieve on their service plan. So whether a child is eligible for level of need and can access some of the HCBS services, whether they need state plan services, the health home care manager, assuming that they're eligible for health home, will play a very important role in ensuring that children are assessed adequately and then have access to the services that they need. So I'm going to turn it over to Andy to talk about the Children's Summit.
Okay, Angela, we've got a couple quick questions that have come in. Do you want to just kind of tackle those quickly before we jump in?
Sure.
So one came in, it just says, I just want to confirm that the state will not mandate government rates for existing carved out services for a period of time.
I'm assuming Heather's question is about the existing Medicaid state plan services. I don't have an answer to that one. We will have to get back to folks on that question in particular.
Okay.
There will be mandated government rates for 2 years on the HCBS services.
Okay, but there may not be mandated government rates for the existing state plan services.
I'm unsure about that. We will have to get back to you.
Okay, great. And then one was, just to give an example of a carved out service that will be at risk, and then what does that mean?
Carved out service, residential treatment facility, day treatment eventually.
Okay. And then what about community habilitative services?
Not our service. That's a service that's more in the OPW system, and to the extent that children will continue to be eligible for that, that would still be available through that system.
Okay, great. So those are the only questions we have. Before we dive into the summit, I just encourage people to, if they have other questions for Angela, to feel free to chat them in, and we'll take them as we can at the end as time permits. And Lydia's going to talk about the Children's Summit.
Thank you, Angela and Andy. Hi, everybody. This is Lydia Franco from the Community Technical Assistance Center. And we just wanted to spend some time talking to you a little bit about our Children's Services Summit, scheduled for June 29th and June 30th. June 29th here at New York City, the NYU Kimmel Center, June 30th at the Hilton Albany. And if you've been looking at our slides, we have our beautiful group of children on a hill, really being very hopeful and very happy as we embrace change together, partnering for successful child and family outcomes. So I just wanted to take a minute and just spend a little bit of time talking to you about the purpose of the summit. I know many of you have gotten our announcements, have heard us talk about the summit, as well as our state leadership team in a variety of different events, but we just wanted to take a second to kind of orient everybody and answer any questions that you have. So our main objective is really to give folks an opportunity to meet in person, to learn about the redesign system, innovative practices, to really think about improving behavioral outcomes for youth and families, and what does that mean as we do this switch in our services in the next couple of years. We want to be able to also talk about partnering with various sectors to provide quality services for successful outcomes, not just across systems, but within systems, across organizations, organizational competencies and strategies necessary to succeed, and any available technical assistance opportunities that we at CTAC as well as MINTAC will be able to provide as we move forward to support you in this process. As many of you have seen in some of our announcements, I just want to highlight a couple important things. The official program isn't out yet, but we hope to have it out in the next few weeks. But I just want to highlight some folks that we think will be a great opportunity if you can come and join us to listen to talk with, and to collaborate with and share some of your questions and concerns. So first, our morning will kick off with our keynote, Susan Dreyfus, President and CEO of the Alliance for Strong Families and Communities. And she'll spend some time really talking about the system transformation, its complexities, and how organizations can plan for the future. I think what we'll also be doing with our keynote is that she's going to be inviting providers from other states who have gone through a transition to managed care, who have adapted some of their models, who are doing similar things to what we hope to be able to do here in the state or already in the process of doing, and give you a couple different perspectives on what that process is like and some lessons learned. We also hope to be able to have a panel of providers, in-state providers, to have an opportunity to raise questions, concerns, and talk with everybody around what some of these things, some of these changes mean for them. And then we're going to have a number of workshops in the afternoon that's going to cover a variety of different things specific to the managed care readiness tools, so some of those readiness domains, some of the new kid services, so how to align with child and family needs, really talking about new service delivery models or different ways of thinking about services. We're going to talk about data-driven clinical decision-making, fiscal strategies for long-term sustainability, and also be able to communicate with you around any feedback that you have around technical assistance you'll need moving forward. The summit agenda, so what we can show you is that this is the basic outline. It will be basically 9 to 5, 8:30 to 5. We don't want to keep people any longer than that, but we hope to have a basic breakfast, our keynote, our case study presentations from folks from other states. We'll be able to provide lunch. We'll have a panel discussion in our workshop series. So we'll be moving pretty quickly throughout the day, but we hope that it will be a meaningful opportunity for folks to be able to network, to connect with each other, to talk with some of our state partners, to talk with us around TA assistance and help as we move forward. We have been getting some questions around how do we participate and who is the conference really targeted for. So all child-serving agencies licensed, certified, or funded by the Office of Mental Health, Office of Children and Family Services, Department of Health, and Office of Alcoholism and Substance Abuse Services are invited to attend. So this is really specific conference for child-serving provider agencies. But we are very limited in terms of capacity and space. So what we really want is for provider agencies to think about a change management team or folks on your team such as executive leadership, fiscal representatives, but also really thinking about are there any family support leaders or youth advocates that as we move forward to really expanding home and community-based services and incorporation of peers in our work, can they also be a part of the discussion and come with you and attend some of the same workshops as well. So we do, unfortunately, have to limit participation. So we're hoping that if agencies can limit to 4 representatives, we'll have enough room for everybody. And as we said, there is one day, June 29th here is in New York City, downstate, and then upstate will be in Albany the next day. So the same agenda on both days, slightly different presenters, but basically the same agenda and topic. So you know as you try to figure out which one you want to attend, that may help to guide some of that decision making. Again, here is information. It was also sent out to everybody on email. We also will have additional information around the summit as we update things, as we have a final program. It'll be on our ctacny.com website, and we'll be getting that link out to folks as well. So you can just keep checking back on our website for any updates as we move forward. The registration process, so there's a couple steps. Many of you have already done many of these steps, so I'm just going to briefly go over this for those who haven't had a chance to yet. As a provider agency, what we would like to be able to see is for provider agencies or the leadership team of those provider agencies to really come together, take a look at the Managed Care Readiness Assessment Tool, both Part 1, which is the general managed care one that we've been kind of talking about and rolling out through our MCTAC, our Managed Care Technical Assistance Center, but that there's also Part 2 specific to children's services and the new service array. So for those who are coming to the summit, we ask you to complete both Part 1 and 2, and this is the link. The link has also gone out to folks. You can also go to mctac.org and click right through to Provider Readiness as well to access both the PDF forms, but also where you can submit the responses online. So you'll be able to submit those online, not on paper format. Once we receive the Readiness Assessment Tool, once that's completed, we then send out to the contact the registration link. And what we're hoping to do, because we really want significant provider agency representation, what we would like you to be able to do is to register as an agency. So those 4 participants that are coming from your agency, we're asking you to register together, not separate registration. That way we can just keep track and make sure that there is enough representation from the different agencies across the state. provider agencies that have already completed the tool, and there's a number of folks, there's a few hundred. Our OCFS partners have completed the tool already. A number of other OMH, ONASAS licensed agencies have also completed the tool. You should have already received a separate email with a direct registration link to register your agency change management team. So if you have not received that, please let us know. You can email or chat in to Brianna now. You can also email us separately or go to ctac.info@nyu.edu and send us a quick comment letting us know that if you haven't received that registration and you have completed the tool, then we'll follow up with you directly to try to figure out how to get you registered. We do also want to be able to open up the summit as much as possible to non-provider representatives as well. So, for example, the non-provider groups would be local government officials or state agency staff or children's advocacy and membership associations as needed. Those folks should have already received an email with a direct link to register, and that is a per individual registration form. We do want to highlight that space is limited, and it looks like we'll probably be able to, have to institute a bit of a waiting list so that as registration continues, we'll be monitoring to see how much space we have and being able to contact you if we've had to put you on the waiting list. Our registration deadline is June 5th, but if for some reason that is a challenge or if you have any concerns about that deadline, please feel free to contact us and we can work something out with you directly. So I'm going to pass it back to Andy, who's going to talk a little bit more about the readiness tool and that process, but I also want to highlight that we're going to spend a bit more time tomorrow on a webinar that will show the time in just a couple slides, but we're going to go into more depth about how to complete that tool if you haven't already.
And there was one question that came in just now about they already completed the readiness assessment tool and the addendum, and are there any new additional information to complete? No, and if you've already done it once, you absolutely should not do it again. If for some reason you got the wrong link from us, as we've been linking, sending this out to about 400 agencies around the state, please let us know, shoot us a note at ctac.info@nyu.edu, and we can always go back in and figure out and make sure that we do have your thing on file and then send you the right link. So if you have any questions about whether or not you filled it out, I would start by emailing us first rather than completing it again, because it is a long thought out, a long process to complete it. So if you think you've already done it, please just double check with us before you put effort into completing it again. Okay, so the readiness assessment tool, just very, very briefly what this is, and we have worked, and it started on the adult side, which is why we've added a kids addendum on top, but the content of the general assessment tool cuts across both kids and adult services. And what we tried to do is actually, we would have gladly borrowed this from some other state, but no other states have actually done this in a comprehensive way, really registered and thought through kind of what are the readiness domains that agencies have to really think about in order to be ready for managed care. And so we worked closely with our state partners, some county partners, some of the plans, the plan associations, several trade association groups, as well as several providers, to really pull together what we thought was kind of a comprehensive look at the areas of readiness that you would need to be able to do to be ready for the transition to managed care. So as far as we know, this is the kind of most comprehensive look at what is an agency, what are the areas of readiness an agency really needs to think through in order to be ready for managed care. And then for this round, we've added on this children's addendum. So many agencies did this as part of the initial rollout, because we encourage children's-only agencies or agencies that serve both kids and adults to do this as part of our initial work around the Managed Care Technical Assistance Center. So, so many of you have already done that, and again, you don't need to do it again. You just need to complete the children's addendum. So it covers there's 11 priority areas. I won't go into them in depth, but they cover everything from just kind of understanding the basics of managed care to contracting to service authorizations to IT, credentialing, finance, billing, all of those kinds of issues as well as kind of the really critical areas of evaluation and demonstrating your value. So we really kind of cover this kind of broad array of areas. Now, I will also say that I'm usually the person who says you can't send out surveys that take more than 5 minutes. And obviously this is not a 5-minute survey, but this is a survey that is worth the time, because if you do it right, it really sets up a roadmap for what do you need to do as an agency to be really ready for managed care. So the addendum, in addition to all those 11 categories, covers early identification and screening, some use of different treatment models and EVPs. It touches on particularly some issues around outcome measurement and tracking, a little bit of kind of where you are in the service array, and then whether you've really been able to incorporate trauma-informed principles as well. Okay, so how do you do this? You go on to our website and you download a hard copy of the tool. It's at mictac.org. And when we talk about MCTAC or CTAC, really they're all housed in the same place. So it's more of a contract difference than a real difference in terms of who the people are and that kind of stuff. So you go on our website, mictac.org /page/provider readiness. But if you just go to mictac.org, it's pretty easy to get there. You download a hard copy of the tool, both the regular readiness assessment and the children's addendum, and then pull together the same people that you're going to bring to this summit. And you might also want to add like an IT person and some stuff like that, or an evaluation person to that group. Pull together that same group, your leadership, your executive management team, and fill this out together. Oftentimes in agencies, and we do this here too, you send the surveys to an intern or somebody who fills out surveys. Please don't do that here. This is an opportunity to really do this as a group and come up with a plan and identify different areas of readiness that you guys really need to be in, and different people in that room will have a sense of what are the important areas that they need to weigh in on. Once you've done that, you go back to the website and just submit your answers into our online survey tool. It's very easy to do that. And then once we receive that, we'll reach back out to you with the link to register. So it's all there. It's relatively straightforward. And then tomorrow, we have a webinar set up just to kind of walk people through completing the tool. So it's pretty straightforward, but we'll be on for tomorrow. We'll probably talk for, I don't know, maybe 25 or 30 minutes, and then take questions, as many questions as people have about completing the tool. We've sent out a bunch of webinars, announcements just to get people signed up for that. If you've already completed the tool, please don't come tomorrow, because you don't need to be there. And if you've looked at it and it looks pretty straightforward, also there's no need to come tomorrow. Or if you can't come and you miss it, but you do have questions, feel free to log on, or feel free to, sorry, I'm just getting over a cold. Feel free to look at the recording of that webinar. It'll be posted on our website with everything else. And you can kind of ask, and if you have additional questions, you can email us and we'll walk you through that. It shouldn't be a burden. Hold on one second. We just got a question about the summit. Okay, so we've got a question from an agency who's really a subcontractor to other agencies rather than a direct contractor to OMH or OASAS. I'm going to ask that person just to send us a note at ctac.info@nyu.edu. There we go. The MCTAC one rolls off my tongue, but now the CTAC one is a little bit gone. So shoot us that note privately, and we will we'll get back to you and kind of sort through whether it makes sense for you to come to the summit or not. Just so you know, here are our two websites. CTACNY.com is most of our CTAC stuff, and MCTAC is all the MCTAC stuff. If you're only a kids provider, a lot of the stuff is on CTACNY.com, but most of the managed care stuff is on MCTAC, and much of that is really welcome and open to adult and kids providers. We recognize that there's been a little confusion about what's for kids and what's for adults, and we're working in the background to kind of sort some of that stuff out. But if you have questions, you can always email us, and we'll get back to you and answer those questions as well. The other thing just to highlight is that we really are expanding our offerings at the CTAC side of the world, and the MCTAC side of the world covers all this as well, to really cover all children's programs, both in the, just kind of the entire comprehensive look at children's programs. So I just want to highlight that for folks. And there'll be more announcements and more details about that coming up either right before or right after the summit. But I just want to highlight that we're going to kind of cover all children's programs in New York State in addition to all adult programs in New York State, really to help them make that transition to managed care. So now is the time for questions. So so if you have questions either for Angela around the presentation that she did, or around the registration or the MCTAC stuff, please chat us in, and we will try to get to them.
So I do have, Angela, if you're ready, I do have a question that came in a little bit earlier as we started talking about the summit, but specific to your presentation. So does the family of one mean that children placed in residential care through CSD who have health insurance, if they meet the level of care and level of need criteria, would this be the mechanism that they will make them eligible for health, home, and HCBS services? And I can repeat that.
So there's a couple nuances in this question. For kids that are placed in residential care, and I'm assuming this means RTCs, HCBS services cannot be delivered in that setting. So even if a child or youth met the criteria, HCBS services cannot be delivered to someone who resides in an RTC or an RTF for that matter. If they have Medicaid by nature of being in one of those settings, that opens the door to state plan services that they need. The important thing to think about is the setting in which they're living already offer care coordination, and does Medicaid pay for that already within the context of the model? If that is the case, then they would not also be eligible for health home, because that would be a duplication of care coordination.
Thank you. So the other couple questions have come in on LDSS participation in the summit, as well as the subcontractor issue. So if those issues apply to you as an agency, just sorry about that. Just shoot us a note at ctac.info@nyu.edu, and we'll be glad to address that individually, because we're sorting through some of those details in the background. So just shoot us a note, and we'll be glad to get back to you. And then, who do you contact at CTAC to determine if our agency has already completed the readiness assessment? Yeah, and we actually got your email, and so we'll shoot you a note back. Other questions that have come up? I'm scrolling through to see if we've missed anything, but other questions that have come up or you're thinking about right now? So while we're just waiting, if any other additional questions come in, I would just like to highlight that there are going to be a number of offerings coming out from CTAC, particularly around children's issues, either right before or right after the summit, so please pay attention to your email and those kinds of things. And if you think you're on our list and you don't get our emails, check your junk mail and those kinds of things, because sometimes our stuff gets sorted there. And then also there's a number of things coming out on MCTAC around revenue cycle management, utilization management, and contracting upcoming, much of which will apply both to children and adults providers. So I also want to really very strongly encourage folks to participate in that and that as well. So I don't see any additional questions. So I think with that, we will let everybody have 11 minutes of their day back and wrap up. So if you have any additional questions after the webinar, just feel free to these are the resources from the MRT website with all the government information on it, and any questions about children's managed care, reach out to Angela Keller, and any CTAC questions you can reach out to Lydia. Her email is here, or you can do ctac.info. And then I don't know if we'll be doing an agency level score on the children's addendum, because I'm not so sure if it sets up that way. But what we will do, what we will likely do is we'll do a webinar with the global results and show the whole state kind of how everybody collectively did on the children's addendum, and just kind of lay that out. One other thing right before we hang up is just on the completion of the readiness assessment, we will not share anybody's individual agency data with anybody else. We'll only share that as an aggregate. So just to be clear that once you submit that, that stays within our house, and all the government agencies have agreed to that as well. So we won't share anybody's individual agency information with anybody else. And so that's where we are. All right, so with that, we'll wrap up. And I want to thank everybody for coming, and also thank Angela in particular, as well as all the other government folks for pulling together the presentation, and Angela in particular for presenting today. And we look forward to seeing all of you at the summit. All right, take care, everybody. Bye-bye.